Imagine you're 13 years old again, back playing sports with your friends. Before you know it, you hit your head and begin to feel unwell. Maybe you feel nausea, confusion, a headache, brain fog, or even unexplained intense emotion. These are all symptoms of the standard concussion. A concussion is any injury that results from a blunt force to the head or body that results in cognitive and neurological impairment. I'm assuming the majority of you have either experienced or witnessed a concussion at some point in your life. In fact, if we look at youth athletes or youth individuals in Canada during 2016 to 2017, 46,000 youth reported concussions in that year alone. If we review research literature on youth and concussions, it is quite limited in terms of management and assessments. This is because the majority of research is performed on athletes at the professional and varsity level. There is very little research exploring concussion management in youth. So what are the current assessment and management in youth athletes? Well, the current assessment for concussions in youth and adults is the same. It is known as the Standardized Assessment of Concussions, or a SAC test for short. It involves having an athlete take an assessment at the start of a year, known as a baseline, and using that same assessment results to analyze to see if they have a suspected concussion. Management of concussions is often a standard return to play approach, which has graded stages before a participant returns to play. It starts with complete rest, followed by light activity, moderate activity, returning to practice, and then practice with contact if the sport has contact. The problem with this approach is that due to the complexity and individualism of concussions in athletes and the variability between youth and adults in terms of severity and duration, the same treatment for both youth and adults may not be sufficient. In fact, research which monitored neurological impairments in youth noticed an increase in severity in symptoms and had significantly longer recovery, lasting up to 3 weeks to a month post-concussion compared to adults. The risk with return to play protocol is that we already know that youth experience longer and more intense symptoms during a concussion, and that returning to play too early can return to second impact syndrome, which is when a person receives a second concussion within a short interval of the first concussion that is more severe and longer in duration than the previous. So what I propose is that if we extend the duration of the current standardized treatment for concussions to a minimum of 3 weeks, which is the typical duration of a severe concussion in a youth, will that help reduce the risk of second impact syndrome in youth athletes?